with that, I'll turn it over to Ms. Amanda.
Okay. Well, actually, I'm Dr. Lace. I'm going to just welcome all to the second webinar. Today, it is my pleasure to introduce Amanda Young, who will present the first My Story presentation. This is when the patient gives us their perspective on West Nile virus and how it's changed their lives. The My Story will be repeated at future webinars as well. It's clearly time that we listen to patients' perspectives, and it's important because their brains and their bodies are the ones that hold the secrets to better therapy and more effective interventions. Without further ado, welcome Amanda Young.
Okay, here we go. Hi, my name is Amanda Young, and I am part of Mosquito Illness Alliance Board of Directors. I am the Secretary and Patient Advocate. Today I'm going to tell you my story. I hope it will enlighten you, touch your heart, and most of all, bring us all together as survivors. First, let me tell you a little bit about myself, my pre-West Nile self. I was a 34-year-old single girl who was the life of a party, loved life, laughing, and making others laugh. Loved going out on the weekends and hanging with my friends. Loved family time, camping, water skiing, snow skiing, and vacation at the beach. At the time, my joy in life revolved around my 4-year-old niece. I loved to rollerblade and run and was training for my first half marathon. I was a pre-K teacher and taught dance at night. I lived a healthy life. Life couldn't be any better. I had my whole life ahead of me. Plenty of time to get married, to find someone to settle down with, and have kids. Why rush? So I thought. Then my life changed. July 2013. I was planning a trip to Disney World with my niece and family and some friends for Halloween, my favorite holiday. I had gone to my family doctor for what I thought was maybe a sinus infection on an early August morning. Slight swollen glands, crazy strange head pressure. Got an antibiotic and on my way. Tuesday, I went for my daily run. Wednesday, I was trying so hard to run, but mostly walking it. Thursday, I went home and went straight to bed after work. Not me at all. Friday, I was falling asleep at work. My head was beginning to feel heavy, and things were starting to seem cloudy. Again, not me at all. Straight to bed. Saturday, my family leaves town for a camping weekend. My friends head out, and I'm bound and determined not to be sick. I don't get sick. I get up, pull myself together, and go get my nails done. I'm one of those girls. It takes every last ounce in me to make it through just sitting there. I'm starting to wonder what the hell is going on with me. And it was like one day I was tired, and the next day I couldn't even move. I couldn't believe I was going to have to go to bed on the weekend. Friday, I was falling asleep at work, and Saturday night, the glands in my body were starting to swell. They became so enlarged in my neck, I had problems swallowing. The pressure in my head was like nothing I'd ever felt, and this was just the beginning. The pain was starting to become unreal. One night, a friend brought me a milkshake, and I could not look at her in the face from a seated position because my head and my neck was so rigid and stiff. I was so weak, I couldn't suck through the straw. At that point, I got scared. Something as simple as sucking and swallowing was a chore for my body. I got to where I couldn't move my head at all, let alone hold it up. Over the weekend, my best friend, who was an ER nurse, talked me into going to an urgent care. They run mono, strep, and flu. They all were negative. I get another antibiotic. I decided not to start that one because I had made an appointment with my doctor on Monday morning, and she may change it or have a better idea. Monday morning, I dressed myself, stiff neck, shaking, can't really talk, can't hold my head up, eyes are glazed over, feel like death, head feels like it's going to explode. My doctor takes one look at me, scared, says, I'm going to run blood work, but I foresee you going into the hospital tomorrow. I had one small problem, no fever. She too runs the flu test just to be safe. Everything comes back okay, probably just showing some kind of virus. So I was told, hold on, call back if things get any worse. Wednesday, I can't take the pressure anymore. A rash appeared. The pressure in my eyes was unbelievable. The lights were starting to hurt them. I go back to the doctor, grasping at anything, maybe a bladder infection. Negative. She was exhausted with ideas. She said it was time to go to the hospital. I picked the hospital in our area that I think would be the least crowded. They ran all the same blood tests. I even asked at this point, could it be West Nile? And the response I got was, there was nothing we can do if it is. The nurse told me maybe I was depressed. At that point, I looked over at my friend who brought me, and thank God my mom wasn't there yet. And I asked if I was crazy. I had never felt like this before, and I was in so much pain I couldn't imagine. I left devastated, in total pain, but with no help, and becoming weaker by the second, and dizzy. The only thing they did for me was a potassium pill because it was a little low. Like I said, the pain in my eyes was unbelievable pressure, as if it was going to slowly pop out of my head. I was slowly starting to feel like I was no longer in my body. Any sound was deafening. I couldn't stand to hear the light switch turn on, much less take the light. I could hear all the static in the world that no one else could. By the next Sunday, a week later, friends and family were starting to get past the point of worried. They talked me into going to another hospital. By that point, I could barely stand up. The walls were my guide, and oh, was I weak. They could barely get the IV needle in. Of course, this time I had a CAT scan, and they did a spinal tap. Later I learned they never ran the right test. My blood work suggests a virus. I had all the symptoms of West Nile, but no fever. They tell me, you have a strange virus, so go home. They discharged me from the hospital. Little did I know, 5 minutes into the car ride, I was screaming. Another pain I had never felt before. My mom wanted to take me back, but I wouldn't let her. I had been through enough. No one was helping me. No one cared, so it seemed. Anyway, I just wanted to go home. I've never seen my dad so scared in his life. I will never forget his face. I had a spinal tap headache, and that headache, on top of a viral headache, was almost more than I could bear. Going to the bathroom and having your father pick you up to walk you back to the bed because you're crying in pain, because nothing wants to work, seems like such a low moment in your life. Of course he's mad. You're home and not in the hospital. So here I am, 3 weeks into this crazy mess. The Tuesday after the second hospital trip, I made it in to see a neurologist. He took one look at me and said, has anyone tested you for West Nile? He got up and looked at the hospital records. No. So number 1, go straight and get this blood work done. Number 2, I believe you're having a spinal leak. And number 3, you need to see an infectious disease doctor. Okay, so no answers, but finally maybe some answers coming and some medicine that can help me since I don't do pain medication. By the time I start coming across people that I knew, but I didn't know who they were, I was getting lost in my one-bedroom cottage house. I was starting to get scared. How could this be happening? To hide it from others. I didn't want to worry them any more than they already were. But inside, I was thinking, what the hell was going on with me? And the worst part was, no one could tell me. It took a week for the blood work to come back, and the phone rang Friday afternoon. You have West Nile, and with your spinal leak, I need you to stay on your back, complete bed rest. Okay. So at this point, maybe I felt like all of you. I could breathe a little. I have a diagnosis. Ready to fight this head on, right? Wrong. I hear there is nothing. There is no treatment because it's a virus. What do you mean there is nothing? At this point, everything got dark. 4 to 5 weeks into this craziness, my face was becoming deformed and paralyzed. I looked like I had a stroke. The left side of my body was becoming weaker. I was becoming less stable. I was pouring water into my hands instead of medicine from a medicine bottle. My hair was falling out and my toenails were falling off. Clearly not myself, but all alone and still no help. At this point, I call it my giving up point. I know we have all had them, and if it's your loved one you're dealing with, please don't judge. We all reach that breaking point. That time we have to dig deep in our souls and find whatever you can to make it to the next day. I'd been given so much steroids and told to take so much ibuprofen. But what I was told was brain swelling, that I developed severe gastritis. No one told me to protect my stomach. One of my worst nights, I will never, ever forget. I had a huge knot in my stomach, which turned out to be a cyst. My mom was so scared by all the pain in my stomach, she was scared for me to take anything. I knew the hospital wouldn't help. No, I wouldn't go that night. I prayed so hard to go home. I didn't want to fight anymore. I couldn't lay down or sit because I couldn't take the pressure on my head. So I would get up and walk around. And when I couldn't do that anymore, I would repeat it. But the pain got the best of me. And I said my prayers, and I told God everyone would be okay without me. And I asked for forgiveness, and I closed my eyes. But as you can see, He did take me. And all I can say is He has a plan, and He wasn't ready. But that night, I surely was. And I will never forget that moment. The next day, the doctor, and I learned about all the upper GI and gastritis and the medicines I could no longer take. A CAT scan of the abdomen that found all these incidental findings. More tests. I've never seen so many scared faces in my life. I think I was too sick to really know what was going on. I knew I'd looked death in the eye, and as much as maybe I didn't want to at times, I had to survive. It was the hardest fight of my life. Nights when the whole left side of my body was paralyzed and had no feeling. Headaches out of this world. Stomach pain where I couldn't move. I would pray to God if He would just take one away, I would take the other one back. The next day, I would wake up with the other one and cry, saying I was sorry. I was just kidding. People would ask, what could I do for you? What do you want? I just wanted a hole in my head. That's all I wanted. I couldn't stand the noise or the light of the TV. It hurt my eyes to look around. So I couldn't read. So I was stuck sleeping when I could, or crying in pain when I couldn't. Then there's the doctors. I know we could spend many of WebExes on this, right? But they are there to help you, and they are supposed to. The sad thing is, in the beginning, I spent so much time searching for answers. Everyone has the doctor for you. But in reality, most of the doctors have the same answer. Either the West Nile is gone, or we can treat your symptoms. At the time, treating the symptoms for me was to drug me out, and that was not the answer I was looking for. I had one doctor that would not even acknowledge my positive West Nile test because his hospital didn't order it. Nor did he want to acknowledge his own colleague's diagnosis of Bell's palsy because he didn't actually catch it. Doctor fired. I had a doctor tell me maybe I had post-traumatic stress disorder, all with fibromyalgia. Believe me, I'm not knocking either one of those, but I was a runner and a dancer with many injuries, and I've had torn and overused muscles, and I kept going until I was told to stop or you don't run and dance again. A quitter, I am not. So don't pity me and tell me I can't, and what I'm feeling is not real. So within that year, I have to say, I visited at least 10 different doctors, and that's if I counted them all. That's one of the most exhausting things. I had to take a break, much to the disappointments of my loved ones. They would think I was giving up. But that wasn't the case at all. You have to take a different approach for a while, a breather, because otherwise you may go crazy. The point I left my neurologist, I was in his office. I had been through about 7 different depression medications. One had me hitting myself in the face, but that was not the medication, even though motor tics were listed as a side effect. I had 2 treatments of Botox for the headaches. The first paralyzed my neck to where I was unable to hold my head up again, but of course, it was not the Botox. The second, we reduced the dose, and I could at least hold my head up, but no help from the headaches. I still wanted that hole in my head. The most relief I got was from Imatex injections. It's what I still use today, although I still have daily headaches. The breaking point is when he was going to put me on a drug and slowly increase it. I got in the car, called my mom. They just want to make me a zombie. Why? I can't live like this. So I would hold my tongue till holding it wasn't possible anymore. The fatigue, the pain, the weakness was so severe I couldn't take it anymore. But I knew once I opened my mouth, I would hear the word specialist, another doctor to explain my story to. Did they really know about West Nile? Did they believe this came from West Nile? Who will I go to? All the blood work, the test. Then you see the doctor. And again, the tears begin to roll down your cheek because they don't understand. You just need to do more, they say. Internally, you're screaming. They aren't listening. I'm doing everything I can possibly do but give up. And I refuse to give up. That's when I decided specialists were not for me for a while. I went back to my original doctor, and really, she's a nurse practitioner and still my doctor to this day. She knew me before I was sick, and she knows how sensitive my body is to medications. We work together. She listens to me, she lets me do my research and bring it to her, and if other survivors are trying that medication, she researches it and lets me try it. And one of my visits, she said, "Don't you think it's time to visit another doctor out of state?" My reply was yes, I would love to, but where? Us West Nilers spend a lot of time on our own, researching every waking moment. In my research, I came across a West Nile support group in Hattiesburg, Mississippi. Through that support group, I met Sharon Sims, who led me to Dr. Lace. Yes, I was very lucky to visit with Dr. Lace, July of 2014. My cousin and best friend drove me the 2.5 hours to Jackson. We were all nervous, but ready for some answers. I walked in with a 3-inch full of anything he could ask for, all tests, blood work, labeled with dates, a calendar labeled for a year with every symptom. He was amazed and maybe made a little side comment that I may be a little OCD. Dr. Lay spent the most time a doctor has ever spent with me. He made sure every question was answered, well, as best as he could. The one I wanted to know the most was, can I teach dance again? That was my passion, my love, my want, what I went to college for. I must have asked Dr. Lay 10 times. Every time he would say, I'll tell you when I'm done. I was already trying to teach dance, but it was pushing me, pushing my limits, hurting me, my brain, my body, my everything. Everyone had told me to just give it up. Every night I would come home crying in so much pain. I would call anyone that would just listen. I just wanted my life back. I just wanted to teach my kids. My little 4-year-old niece that only wanted her aunt to teach her dance. Just a little side note. My first day back, my little preschoolers all showed up in their sunglasses. It was the warmest feeling. They didn't care if I was sick, if I moved slower, if I was weaker. They just wanted me. Back to Dr. Lace's answer, he said, there comes a time when you have to start listening to your body. He compared me to a past West Nile engineer patient that had cognitive problems. When you can't do something anymore, then it's time to move on. Well, that wasn't the answer I was looking for. Guess what? I didn't listen. I think I'm stronger for it, except on my weaker side. I still lose my balance, and I'm still scared to wear high heels, but that's okay. Even on bad days, I come home and I still cry. One of the things that Dr. Lace was still insistent on was treating the symptoms. Although I hated doctors, maybe I needed to try again. The specialist wrote. About 8 weeks after coming down with West Nile, I became deathly ill with nausea and a swollen stomach. I would eat healthy and then break out in a rash. Sleep on the floor in the bathroom. I for sure thought I was going to throw up, even though I had lost my gag reflex. I was dying all over again. Now it's something else. Well, fate brought me to the best GI doctor. Finally, he evaluated me and gastroparesis. He knew I needed a gastric emptying study. I did liquids and solids. Before I could get home from the test, the office was calling me. Gastroparesis it was, which causes paralysis of the muscles of the stomach and intestines. They stop working properly. This has been followed by inability to absorb certain sugars and vitamins, called malabsorption to fructose and sucrose. I lost a lot of weight because of my malabsorption and gastroparesis and dropped to 115 pounds. I became a pale walking skeleton. Months later, I started having heart problems. I felt my heart was starting to race and slowing down, along with a lot of other symptoms. I bring my symptoms to my nurse practitioner, and she never waits. She's on it. EKG and a 24-hour monitor. Fast track into a cardiologist who set me up with a 3-week monitor and ultrasound. Again, things sound great. Treating the symptoms. I've learned through all of this, always get your records for the appointment. I go into my appointment well informed, knowing every EKG reading and what they meant. The doctor, on the other hand, was not so prepared. I think he thought he could wing it. My heart was hitting 165 beats a minute, at times early in the morning, not doing anything physical, and then dropping into the 30s. God only knows what my blood pressure was doing. When I asked him to explain, he told me I needed to just start training and running, reset my heart. My heart was so out of control, he asked me to reset my heart. You can only imagine how angry I felt. I already felt like I was going to pass out, dizzy as can be. Several times I blacked out, spent times on the floor in a store, and once on a checkout rack. Can you only imagine how embarrassing that was? A poor, innocent young boy, probably his first day, and I'm passed out in his checkout line. There were days I couldn't walk without feeling faint. Needless to say, my cardiologist got an earful, and he was fired too. Every time I would see Dr. Lace at the West Nile support group, I was very persistent that something was different about me. And actually, you know what? He believed me. Something I had trouble with, even with past friends. It's hard to believe that you find who your true friends are in an illness, who will stick by you, who will walk away. Many walked away, and many new ones have walked in. The last time I saw Dr. Lace, I had given him my 30-day heart monitor reading, labeled and marked like I always do. Most doctors, even specialists, don't seem to really listen. Sound familiar? They say, you can't still be having issues with this. In January of 2016, I got the opportunity that most do not. Under Dr. Lace's care, I flew to Mayo Clinic in Arizona with Sharon Sims for a multitude of tests. Autonomic nerve test, catecholamine test, EMG, nerve conduction study, neurological exams, and full blood workup. I was also able to meet with some of the best doctors in the world. I had a feeling of hope again. I was fortunate enough to see Dr. Brent Goodman, a neurologist who specializes in autonomic nerve testing. He concluded that West Nile encephalitis had left my body slightly weaker on the left side, and then it had damaged my autonomic nervous system. He gave me an optical nerve block to help with the constant nonstop headaches. He also diagnosed me with posterior orthostatic tachycardia, otherwise known as POTS syndrome. As far as my gastroparesis, the GI specialists are trying different medications to see if it will help things out. I was also able to see a dietitian while I was there, who educated me on what foods my body can tolerate for both the gastroparesis and malabsorption. My home GI later added sucrose malabsorption and started me on a new medication. After all of these tests, the real fight began: how to treat this. Dr. Lace had diagnosed me with autoimmune autonomic neuropathy caused by West Nile. He knew I needed intravenous immune globulin, IVIG, to control my immune system. But with the insurance, go for it at $50,000 a month. Battle after battle, fight after fight, he won. May of 2016, with 2 days of a phone call, approved the IVIG, I boarded a plane for Arizona. I hoped no chance they would back out. 5 days of infusion. On the third day, I had an aseptic meningitis headache caused by the IVIG, but refused to give up. I've been through worse. Let's keep rolling. My insurance company tried to prevent the IVIG by saying I could only do the treatments in Arizona. The next month, I flew back to Arizona with Miss Sharon, my chaperone. After 3 months of IVIG treatments, all autonomic blood tests were run, and guess what? The IVIG was working. In particular, Dr. Goodman said there was a night and day difference in my autonomic test. This meant my insurance company had to continue paying for the treatments at home in Louisiana. So fast track to today, I realized research is something I have to do for myself and find a group of doctors that I can trust, even if it's a few. In addition to the doctors I already mentioned, my local chiropractor has been a lifesaver at times. Even on his days off, he would see me. He would help in any way he could. Some of the most caring people just want me to have my life back. Today, my autoimmune problems followed with West Nile continue. I'm dealing with a newly diagnosed inflammatory and autoimmune problem in my body. I now have a positive SSA Sjogren's blood test and a small fiber neuropathy diagnosed by skin biopsy. Sometimes I feel like my body is an endless fight. It often needs iron infusions ASAP, which I got Tuesday, because my white counts neutrophils have dropped to a really low level after West Nile, but I refuse to give up. As a survivor, the persistent or delayed effects is the biggest problem that I see with West Nile, and most patients do not get help from the doctors. There are so many of us out there that need help, from the initial diagnosis that gets missed to the continuing care that doctors don't know about or don't care to manage. Most of us are left in limbo, not knowing what lies ahead. Limbo is a horrible place to be. This is truly a major problem. We need better answers, and doctors need better information. Since being diagnosed in 2013, I have worked to stay alive, and I want my life back. I long for it, just like all of you. I don't want to be a complainer. The fatigue, the pain, the gastroparesis are part of my new life. I know I'm continuing to teach my doctors to this day about the reality of the afterlife of West Nile. West Nile has changed me and all those around me. You never know what an illness does, not only to you, but it affects all of your loved ones. You don't realize just the simple things in life you appreciate, what you took for granted, that can change in an instant. I work to live now. My weekends are spent to recoup for the upcoming week. Sure, I go places from time to time and hang out with friends, but it is nothing like before. I've learned to expect headaches. I don't really know if I've truly been headache-free. I live really day by day because tomorrow is so unknown. If sharing my story helps just one of you, inspires you, then I guess my job is done. The saying everything happens for a reason is not my favorite saying. But sometimes I think that I have to help others. And if it isn't, I said it. So I still have life. I still have bad days. I still get angry. I still have moments I cry and I'm shaking and in pain and crying in pain and no one can fix it. But one thing I look for is hope. Hope that tomorrow will be better. Hope that I can teach someone about West Nile. And hope that I can do something for all of us as survivors. I remember my second support group meeting, I met a survivor, basically the same age as me, but was much worse off than me when she first got West Nile. She called me a newbie. She told me it was going to be a long road, but I could do it. She gave me her number. We have become friends and we encourage each other. I actually read her story on the internet before I ever met her. Dr. Lee saved her life. She became my inspiration. If she could survive, if she could struggle day in and day out, walk the valleys of hell, so could I. I always think of her on my bad days. She is my whisper of hope. I challenge you too to find a whisper of hope, whether it's a fellow survivor or even someone that's struggling with another disease. Find a way to help yourself daily. We can all do something to help get the word out about West Nile. Not long ago, I contacted the media myself, and they said they loved having these stories, but because of HIPAA, they have to wait for the stories to come to them. Teachers learn about checking their yard and toys for standing water. It all starts with us. We can make a difference. Telling my story is always tough. It brings back memories that sometimes I don't want to relive, but I hope it gives you a face to identify with. There's still so much left to be discovered about West Nile and the symptoms that come with it. There is so much more research to be done until doctors, hospitals, and the CDC can learn how to best cure those suffering from West Nile. The best thing we can do as a community and survivors is to prevent it entirely. I don't know when or if I will ever feel like the person I once was, but I'm hoping that one day I will be fully cured and have my life back. Thank you.
Thank you, Amanda Young. That was very effective, very inspirational, and very moving. While I get my presentation ready, I'm going to go ahead and answer a question that was handed to us from one of our listeners, Kendra, and she asks, is there a correlation between how highly elevated IgM, how high elevated IgM is during the acute phase of illness and the body's inflammatory response and or long-term symptoms? And just to clarify, I'm trying to understand if high IgM levels mean the same thing whether IgM is 5 or 15 or 30. And so, Kendra, to answer your question, there is no correlation. Whether the IgM level is 5, 15, or 30 is much more dependent on the timing of the blood draw. If you draw it too early, it may be before IgM has formed. If you draw it too late, it may be IgM may be at high level or coming down. I've had patients who I know had the IgM level and IgG levels drawn too early, and they were negative and negative. But waiting 1 week alone showed that they were IgM positive and then IgG negative. And then waiting another 2 weeks, they were both IgM and IgG positive. So this is more suggestive of the timing and not the absolute number, not the absolute value of the IgM or the IgG antibody level. Okay, I'm going to go ahead and do a follow-up to Amanda's story. Okay. And thank you, Amanda. The struggle is real, and we all recognize the struggle is real. We have all made a commitment and a resolve to cure this disease, but we're not at that stage yet, okay? And right now we have to focus on the patients and their perspectives and on their symptoms. And before I actually comment on Amanda's symptoms and her body, I want to ask her one question, and just think about the question. I want to ask you, where do you think you would be today if no one had ordered the West Nile virus test that confirmed your diagnosis?
Not here.
The answer was not here.
Yeah.
You mean you would have moved to Alaska or?
No,
or?
I wouldn't be in this room.
Okay.
That's a good question. But struggling. And fighting.
I noticed.
And fighting for my life still.
Yes, I noticed you mentioned limbo, and limbo being a horrible place to be.
Yeah.
And so
a lot of people are stuck there.
They are stuck there, but I'm going to let you know that there's relative levels of being stuck. And so the next couple of slides are probably the most important comments I'm going to be making. And one of the questions that I thought about was, are there other Amandas? And if so, how many others? And we can get a glimpse of this by two studies, pivotal seminal studies that were performed. One was from Arizona during a 2010 meningitis and encephalitis outbreak. This was when West Nile virus outbreak was being socialized publicly and publicized. And so this group reviewed the cases of meningitis and encephalitis during that outbreak, and what they found was that only 24 of 60 patients, that's only 40%, who had meningitis or encephalitis during a West Nile outbreak were actually tested for West Nile virus. And if your age was under 50, only 23 or 28% were tested for West Nile. Amanda was age 34 when she developed her infection. The Arizona group also found that most patients were simply left with an unexplained meningitis or encephalitis diagnosis, particularly the younger groups. The implications is that there are a lot of Amandas, and the Amandas are the tip of the iceberg. How many, we don't know. And it's clear, though, that if our Amanda thought she was living in limbo, you imagine what these individuals who have similar symptoms, some less severe, some more severe, but no diagnosis. I can't imagine. The word hell was used a few times. You know, all I know is I hope I don't go there someday, but the reality is that would pretty much be my definition of hell on earth, to be having her symptoms and no guidance at all. The second group was from our colleagues in Houston, and they examined a number of West Nile tests. They examined the number of West Nile virus tests that were ordered during an endemic region. This is in the Houston metropolitan area from 2005 through 2010. And there were 9 hospitals that participated in this retrospective study. And what they found was that only 281 out of 751 patients, that's 37%, with meningitis or encephalitis were actually tested for West Nile virus infection. And only 25% of children 18 years or younger were tested for West Nile virus. The implications are very similar. The majority of people who present like Amanda are never tested for West Nile virus infection. So can we identify the lost Amandas? We had the pleasure and the privilege of actually inviting ourselves to Houston to meet Christy Murray and her group at Baylor College of Medicine, and Rodrigo and his group at the University of Texas Health Sciences Center in Houston. They merged and created an just very impressive arbovirus program, and have always had an emphasis on just West Nile virus infection. We left that program with the concluding that there was no program in the country that was better situated to identify the lost Amandas. And I say that because they have access to hundreds, if not thousands, of serum and spinal fluid samples in all those patients that they gathered the information from 2005 through 2010 or 11. And they can actually go back and now perform the testing. So they can look for IgM West Nile, they can look for IgG antibody, and they can look for all the biomarkers. There's a bunch of biomarkers that are liberated and that are increased in terms of following a West Nile virus infection. These proteins such as S100B and HMGB1, there's a number of interleukins, which are cytokine proteins that actually usher in worsening inflammation. And then there's RAGE in the middle, which is one of the major players in terms of raising inflammatory and causing an inflammatory cascade. And so we spoke about was going back and checking these values, the IgM and IgGs, and in those people who do have West Nile can be confirmed retrospectively, what was their outcome? I mean, how did they do compared to the group that did not test positive for the West Nile virus. Based on our experience, which is anecdotal, but we've seen, several hundred cases, there's a huge difference between having an aseptic meningitis from an unknown virus and then having an aseptic meningitis due to West Nile virus infection. These individuals have the recurrent, lingering, protracted, and delayed neurological deficits. Let's talk a little bit about Amanda's initial symptoms. She went to her family doctor for what she thought was a sinus infection. I'll tell you that is not at all uncommon, and it was in early August. The symptoms included slightly swollen glands. I assume that you were talking about the neck, maybe the armpit area, and this crazy, strange head pressure. Nice descriptive term, crazy, strange head pressure. She was tired, she was fatigued, she went for her daily runs, she was then mostly walking and then going straight to bed. And most of these by the way, the timing, impeccable. If you look here at the number of reported viral neuroinvasive disease cases by month of illness, you'll see that in August, it's literally the peak month in each of these outbreaks. And so her symptoms actually occurred smack dab in the middle of the peak West Nile season. A minor take-home message is that if you have a symptom during West Nile season, particularly like in August or September or July, think twice before you accept the diagnosis of flu. Flu does not occur in July, August, or September by and large. West Nile does. It is now the primary and most common cause of sporadic encephalitis in the United States. So she had a lot of the classic symptoms of West Nile fever, but she didn't have the fever. She actually had shaking and chills, the headaches you heard about, what we call myalgias and muscle aches, and she had the GI issue that developed a little bit later. She developed a rash the following week, and the swelling of the lymph nodes actually got worse also the following week. So what was happening in her body after the initial mosquito bite? The female mosquito essentially injected the virus into her skin, and very quickly immune cells and skin cells actually came in, and what they tried to do was literally gobble up the virus. But what happens with West Nile is that it enters these particular cells and then doesn't die. It literally rides these cells into the lymphatic flow, and then from the lymphatic, so if you were bitten here in the hand, it would ride these cells into the lymph nodes here in the neck and spread them throughout the body. And if you don't know, what happens to lymphatics is that they actually drain into the venous system. And so veins, it goes to the arteries, and very quickly the virus is disseminated throughout the body. And so Amanda lost that fight. Her body lost the fight. And it ended with this, what we call viremic spread of West Nile to her spleen, kidneys, liver, and eventually her brain and spinal cord. So her progressive symptoms, she commented, one day I was tired, the next I couldn't even move. The other worsening symptoms, her glands became more swollen. She actually developed the rash. She had pressure in my head like nothing I'd ever felt. Every week it was getting worse. The head and neck became rigid and stiff, and this is one of the classic clinical hallmarks of a meningitis, and that is what we call nuchal rigidity or meningismus. When a patient is lying down, I can take the head, and if I passively flex the head and they say, it hurts, and I'm convinced based on her description it would have hurt her neck, then that suggests that there is a meningitis. She was also so weak she couldn't suck through a straw or swallow. And that's very worrisome because West Nile virus can actually do that. it can actually target, it's what we call a neurotropic virus, and it can target the cells in the brainstem that control those abilities to suck through a straw, to swallow. And also, it can control the breathing centers. I have a patient right now who's just discharged from the Methodist rehab where I work, and all the virus did was target his brainstem. And so what happened is he couldn't swallow, he couldn't speak, he had no gag reflex, a lot like Amanda, but also knocked out his breathing mechanism. And so he was on a respirator for over 2 weeks, and right now he had no control of any of his facial muscles. And so when he tried to close his eyes, one side remained completely open, the other side remained partially closed, and this was a consequence of a acute flaccid paralysis, or the poliomyelitis variant of West Nile virus infection. And I'm happy that this was not a major symptom, or that it did not persist, because it would have indicated that she had knocked out a lot of these important motor neurons in the brainstem. She went on to have more shaking. She can't talk, can't hold up my head, glazed eyes, feel like death. And then she developed confusion. Confusion is probably the single most common symptom where we decide that it's no longer just West Nile fever. If they develop confusion, then it becomes an encephalitis. And it's interesting because I've admonished her since, when she was confused and couldn't figure out where she was in her tiny house. I don't know how tiny your house is. I've never seen your house, but how many rooms?
It's one.
One? Wow. Okay.
One bedroom, but I mean,
okay.
It's like 3. Like 5.
Well, see,
It's like 3.
that's a bit of confusion, okay? But she had no fever, and it's kind of a social medical commentary that in some states she would not have been considered as a West Nile case because she lacked fever. I mean, and the social commentary is directed at the CDC. They have got to expand their case definitions. In every paper that I've read that looks at outcomes, there are always cases that have to be excluded because they didn't quite fill the case definition. But that's because the case definitions are too narrow. They should be expanding these case definitions, not making them narrow and excluding patients who clearly have this disease. So she actually, at this point, met most of the criteria for a neuroinvasive disease, except that high fever, which you know my position on, the worsening headache, confusion, the weakness. Her left body was getting weak. I'm not sure whether that was because the virus had entered her spinal cord and causing this type of acute flaccid paralysis. I didn't examine her at the time, but she also developed the left facial weakness. I'm not sure if it was actually brainstem that took the hit, or whether or not the problem was a little bit higher up, which caused the left facial weakness and the left part of the body to also be weak. She had tremors, she was shaking, she did not have any seizures, and this thing here called dysautonomia is what I'm going to spend considerable time discussing. So she never went into a coma, although several times she did pass out because of this thing called dysautonomia. So meningitis is, I think many of you have seen this slide. I showed it at the last webinar. And this is infection that's limited to the lining here around the brain. And typically the prognosis for this is favorable if that's all you have and the virus does not attack the actual brain tissue. It's interesting because her first spinal tap was normal. And so that suggests to me, with her constellation of symptoms, it suggests to me that one thing, that it should have been repeated. Now, I've never asked her, but I know about the spinal tap headache. Did you ever have another lumbar puncture?
No, not too much.
She goes, you know my take on that. Okay, I doubt that she was going to allow another spinal tap. But another spinal tap should have been performed.
They did the MRI after that.
And they did the MRI. Okay.
Later.
And the MRI did show evidence of increased signal that was in a gyriform pattern and was suggestive, certainly not definitive of an encephalitis. So again, by the time you have encephalitis, you start developing her symptoms, the confusion, getting lost in a very confined space, and she was doing other behaviors that were very odd, and then the left body weakness all suggest that she had West Nile virus encephalitis. Fatality rate is 5 to 15%. It's clearly higher in the immunocompromised and in the elderly. She was neither of those. But it's interesting, and we can reflect on the fact that I think she had Hashimoto's thyroiditis prior to her West Nile virus infection. And that's something that suggests that maybe she had her body's immune system was behaving a little bit differently. We know from retrospective studies that once a patient has an autoimmune condition, they and family members are going to be more prone to develop other autoimmune conditions. With respect to the human infection pyramid, this is based on the reported cases. About half the cases are going to be West Nile fever, the so-called summer flu that in prior years was thought to be a relatively benign condition, and half of are going to be neuroinvasive cases like Amanda's. 8% roughly are going to cause no symptoms, and we believe are going to generate lifelong immunity because of the IgG antibody. And in some cases, the IgM antibody can also persist for several years. Either way, that offers immunity to West Nile, but not to other arboviruses and not to other flaviviruses, such as Zika virus or dengue or yellow fever and so on. Amanda went through the fever and developed the meningitis and developed encephalitis. I don't know for sure whether or not she actually had the acute flaccid paralysis as a cause of her left facial droop. Given that she still has a little bit of a left facial droop, and I can see it every once in a while when she actually gets tired, I believe it was probably a combination of both. So it's interesting that she developed delayed neurological deficits. And these deficits occurred at a time when the science says that West Nile virus has been eradicated from the human body. I used to believe this, and I remember having a conversation with our colleagues at CDC, and they were seemingly convinced that the virus was eradicated by day 10 in virtually 100% of humans who had a normal immune system. Anyhow, she developed this left facial droop, and then a more subtle left-sided, what we call hemiparesis, 4 to 5 weeks into her illness. Then she developed the gastroparesis several months, not several months later, but several months after the onset of symptoms. So her gastroparesis, literally her gut stopped working. We noticed the heart rhythm problems, and then with the fact that the heart was speeding up and then slowing down. And it wasn't necessarily tied to exercise or activity. She also developed this orthostatic hypotension, or what was here was the postural orthostatic tachycardia syndrome, and this is probably why she was passing out. She also reported a change in sweating. These are all things I had documented in my evaluations on Amanda. Initially, it was too much and then too little. She felt strongly that her body was not regulating her temperature. She wondered whether or not this is why she had no fever. I don't know. She was clearly losing her hair. I remember I hadn't seen her for about 6 months, and I saw her one time after that, and I was like, yikes. I just, I don't want to say. I mean, she's young.
Can you say nothing?
I didn't want to say anything, but I mean, yes, she clearly had alopecia, and she reported that her toenails were falling off, and dry mouth, but no dry eyes. By the way, your hair looks beautiful today.
Thank you.
Okay.
Thank you.
Okay, and this slide I put in for a reason. She quoted, he was amazed, or Dr. Lace was amazed, and made a little side comment that I may be a little OCD. Well, I'd say after that I think that first visit was 3 hours long, maybe longer. And she brought this in, and here were all these little, what are these called?
Pull tabs.
Yeah, little pull tabs, okay, Post-its on where I should be looking in 250 pages of records.
Okay.
And I knew here, the little, what's it called, Bitmoji here, the struggle is real, and I kind of knew after that point there was going to be more than just one struggle, okay? But this is interesting that, again, all these delayed symptoms, and there was a clinical enigma. We started realizing it in 2002 and 2003, and this is what gave rise to the concept that West Nile virus is quickly eradicated by the immune system. From the first 4 years after it gained entry into North America, the CDC could not isolate West Nile from anyone in the Western Hemisphere. So that's all of Canada, U.S., South America. And of the 2,671 cases that they tried to find the virus, 0 cases where the virus was actually isolated. All attempts to recover West Nile from humans failed. And so they actually tried to look at this and determined that it had to be quickly eradicated, or they would have found it. And that's powerful evidence. I don't know if it's overwhelming evidence. I know that Dr. Murray and her group at Baylor and the UT group have published a few papers that suggest that West Nile virus could actually be dormant or hiding out in the body. I don't know that for a fact, but I'm kind of eagerly awaiting what they find and if they're actually able to isolate virus hidden somewhere in the body. I got to tell you, it's very easy for a virus to hide in the human body. Chickenpox does it, and so anyone who's had shingles knows that the virus lies dormant in the dorsal root ganglia, and then during periods of stress or immunocompromised conditions, or things like cancer, the virus can emerge from the dorsal root ganglia and cause shingles. And so it may not do that for years. It may never do that, but it's lurking. So yes, viruses can hide. The question we had was, if the virus is dead, why are there persistent, delayed, and recurrent symptoms in all of these patients to the actual virus infection? We had seen it back in 2003, these delayed neurological deficits. This occurred 21 days after the onset of symptoms, at a time when the virus should not have been viable. We actually described, this is back in I think that's the wrong date, I think it was 2011 or 2012. We described 6 cases of myasthenia gravis that developed several months after West Nile virus neuroinvasive disease. It's a condition that actually, in about 80% of the cases, manifests with drooping of eyelids and double vision. So you see, two television sets instead of one, and that the double vision is not a common feature in West Nile virus infection. Plus, these patients, when they start getting better from the acute flaccid paralysis that was caused by the West Nile virus, they get to the point where they can walk, and the next week they're bedridden again and seeing double. That's a clue that there's something else going on. So we knew these conditions could be delayed, and we think that the reason it happens now is that we now know West Nile virus causes all these important proteins that are pro-inflammatory proteins to be produced. There's a whole bunch of cytokines. A group from Houston found about half dozen. We with a group here with Dr. Fenwei Bai at USM found that IL-17 was particularly an important cytokine that was elevated after West Nile virus infection. And they also were the first to find that this osteopontin could also be elevated abnormal values after West Nile virus infection. But we think that this goes on to cause a post-infectious pro-inflammatory state, what we call PIPIS, P-I-P-I-S, and that's why we have all these persistent, recurrent, or delayed neurological deficits. So how did this PIPIS state affect Amanda? Well, we think that it targeted her autonomic nervous system, although we don't know for sure, because West Nile virus is a neurotropic virus. It actually could have directly destroyed a lot of her autonomic nerve connections. It's interesting that she mentioned she now has a small fiber neuropathy, which is true. They did 3 biopsies, and the biopsy in the lower limb at the ankle level was clearly abnormal. And they actually showed pictures of her biopsy and why the fiber count, the small fiber count. The small fibers are the ones that control all autonomic nervous system functions. And so she has a small fiber neuropathy. Did it come because of the West Nile attacked and destroyed the viruses during the actual event? I don't think so. She didn't develop gastroparesis immediately. It was delayed. She didn't develop the tachycardia syndrome and the bradycardia, slowing down and speeding up of the heart, day 5, day 10, whatever, during the acute illness. That was also delayed. So I think there was an autoimmune basis for all of these delayed neurological deficits. We since have done our due diligence and looked up dysautonomia. It's relatively common. I've seen it in probably about 20 cases, but it's very under-recognized and it's rarely reported. In only one case did I see it where it was much worse than in Amanda. I talked about this briefly the last time. This was an elderly man who was so orthostatic during the acute illness. So I know the virus cannot destroy these connections during the acute illness, that when we would actually elevate the head of the bed, he would stop talking. He would literally have syncope and would have gone into a coma if we would have left the head of the bed elevated. Every time we would lower the head of the bed, he would engage or re-engage in conversation. And I did this only twice to convince myself that this was not just coincidence. The second time, same thing. He stopped talking and literally kind of went into a brief comatose state, and then lowered the head of the bed. He was so orthostatic, meaning that the blood pressure, nothing to pump against gravity, and it all drained from his brain when he was upright. He also, I remember that day I had 4 anti-physician stat calls. That's our way of reporting a code blue. And I would run up the stairs, and the first time he was bradycardic like Amanda. He had fallen into the 30s, low 30s, and next time I ran up there, he was at 160, 170. I think Amanda's range went from really low 30s to 197, I think, was her highest tachycardia. But again, under-recognized and even less reported. So I want to just review autonomic nervous system. It regulates all the automatic vital bodily functions: heart rate, blood pressure, breathing, digestion, bowel and bladder habits, and sweating, among others. I wish I could tell you whether hair loss is somehow related, or nails falling off, but
They're back now.
I know they're back. You actually look much healthier. Okay. Signs of autonomic dysfunction: sudden changes in blood pressure, heart irregularities, fatigue, exercise intolerance, tremors, GI dysmotility, and this gastroparesis syndrome, sweating changes, breathing problems, vision changes. When I recall shining a bright light, I have one of these LED lights. It's not just like the old, flashlight batteries that you have, so much, light emitted. I mean, I shined the LED light into Amanda's pupils, and pupils would literally do this. When you turn on lights, they quickly, boom, immediately, they're going to go from big pupils to constricting pupils. That's the light reflex. We all look at it. All neurologists look for it. Amanda, if the pupil was this size, and I shined the bright light, it would slowly, sluggishly get a little bit, have a partial light reflex. And this was one of the major reasons that I actually diagnosed her with the diagnosis of autoimmune autonomic neuropathy, because she filled the criteria for that condition. We knew about autonomic dysfunction. This is from an autopsy back in 2003. And here you have a bunch of dying cervical sympathetic ganglion cells. These are the ones that are going to go from the upper neck area and control the cardiac rhythm. And so we knew that this was all very possible. And all these conditions could be due to the viral attack. And now we're convinced also the delayed autoimmune attack that can come after the virus has been eradicated. This is Amanda Young 2 weeks ago with Sharon Sims, two of the most important people in the Mosquito Illness Alliance, the current president. She just doesn't know she'll be president forever. And Amanda here with her, oh my gosh, the Alabama t-shirt. Okay. Anyhow, this is what she looks like when she's not troubled by gastroparesis. Okay, this is the same Amanda when she has gastroparesis. These are separate episodes, and what happens when she has a viral attack is that for whatever reason, her gut shuts down. And that to me is not a surprise. Since 2002, I have known that when a West Nile virus survivor does get the real flu or another severe illness, the symptoms literally, the symptoms that were attributed to and caused by West Nile virus recur. It's not because the virus recurs. It's because there's something about the human body and the brain that make this illness recur without the virus. It's not a viral infection that we can not attribute to any type of circulating virus. But Amanda, if you recall, she's a kindergarten teacher now. I mean, talk about being surrounded by viruses, walking viruses right and left, always. And this is why we have all these, these are different encounters. And I want you to talk a little bit more about this condition. It's not recognized. How do I know it's not recognized? Because what happens when this abdomen walks into an emergency room and they have either meningitis or encephalitis or even they're febrile with West Nile fever? What's going to happen? What's going to happen is they're going to go directly from the emergency room. They get a CT scan of the abdomen, and they're going to see all these inflated bowel, gut loops, and they're going to come, and the diagnosis almost certainly is going to be obstructive, a colonic obstructive syndrome, a colon obstruction. Not too long ago, just a few months ago, a West Nile survivor who was about Amanda's age got the neuroinvasive disease. He developed this after they knew he was West Nile positive. And when they saw this particular bowel obstruction, what they thought was a bowel obstruction, they took him to surgery. This is in one of the hospitals, one of the major hospitals in Jackson. They took him to surgery, and which would have been the appropriate thing to do if it had been a bowel obstruction. During the surgery, they found nothing. So they did what they thought was necessary. They took out a normal appendix. Okay? So what went wrong? What went wrong is it was never a bowel obstruction. What went wrong is that they didn't know that West Nile virus causes a picture of pseudo obstruction. It's not a real obstruction. You don't have to operate. But there's very little literature. I wrote a paper on pseudo obstruction, and it had to be 18, 19 years ago, and it was missed then. Okay, it was due to an antibody. The antibody that I've been searching in her bloodstream for repeatedly. She doesn't have that one, but she has others. And so I'm responsible. The group in Houston is responsible. The New York State Health Department is responsible. Same thing for San Francisco and have you. We have to do a better job getting the word out. The veterinarians are responsible. The basic scientists knew about this from before. This is a study from the autonomic nervous system dysfunction in hamsters infected with West Nile. Look at this gut. Look at the sham. They injected sham, which is not a virus that can do this. It's just went through the same injection process, but inject a virus. And this is what it should look like. This is what the West Nile hamsters look like. They clearly had bowels that were given. If this is a human, the difference between this and going to the emergency room with this is surgery. It will be diagnosed as a bowel obstruction. If you're aware that this is what the virus does, and this is why we have to get the word out better than we're doing. So Amanda's heart after West Nile, I felt my heart was starting to race and slow down. There were clearly marked fluctuations, the maximum 197, the minimum in the low 30s, usually around 160s and 30s to 4, and the low was usually the bradycardia was 30s to the 40s. The recommendation to start, quote, lady, you should start training and running to reset your heart. I can't fathom that advice was given. You can only imagine, and she goes, you can only imagine how angry I felt. Yeah. Well, actually, I can't. I haven't been in that position. But the hamster studies showed heart rate variability was suppressed in WNV-infected hamsters. Cardiac pathology was observed by day 9. West Nile infected cells in the SA and AV nodes. These are the nodes that control the rhythm. These are the pacemaker nodes. And they thought that at this time that the data should model the autonomic nervous system dysfunction in human cases of neuroinvasive disease. I showed this before, but half of the symptoms here are going to be linked to, or about 1/3 are going to be linked to autonomic nerves. And we are now beginning to see some reports of sensory and autonomic involvement in West Nile virus-associated acute flaccid paralysis. This is just a single case report, and yeah, I have to do a better job. I have probably, a half dozen or more cases that had, much more severe autonomic failure than in this particular report. And so just one thing about Amanda's immune response. Initially, she was IgM positive and IgG negative. On August 13th and on September 16th, she was positive for both. And this is exactly what we like seeing because it indicates that in terms of confirmation, it gives us the best confirmation that West Nile virus is the cause of any of the new and recent symptoms. I'll go ahead and just skip through that. And so specific therapy, it used to be supportive care was the only standard, but the reality is, and she is a poster child for immunotherapy that was used appropriately, and she has not had any syncopal spells, passing out spells since starting the IVIG. She's been on it now for over a year. Mm-hmm. And I remember I blasted her with intravenous high-dose steroids that seemed to help. But darn if I'm going to keep a young woman on high-dose steroids for very long. I gave her 5 days of the steroid infusions. And then I switched to IVIG and the diagnosis of autoimmune autonomic neuropathy, and I got nowhere. And it wasn't that I was winning the battles. It was in part that insurance companies have some conscience, and I was actually given a clue that to meet their standards and their diagnostic codes, maybe I was not looking at the right condition. The right condition was POTS, P-O-T-S, as she mentioned, postural orthostatic tachycardia syndrome, because it has an autoimmune basis in about half the cases. In the other half, we don't know why. But it was one of the diagnostic codes, and all the insurance companies, they don't necessarily agree with each other. The diagnostic code for her insurance company met the criteria for POTS and for treatment with IVIG. And what happened was we started these treatments. She was truly a fighter. I remember my brother, who was a hematology oncologist, going in and diagnosing her with an aseptic meningitis at Mayo Clinic. And I remember Amanda wanting to come back for day 3 of treatment. And then I examined her at the bedside, and I remember thinking, I'm happy that my brother Joe is a hematology oncologist and not a neurologist, because I did not diagnose her with aseptic meningitis. He did. And so she actually continued. We slowed down the infusion rate, and she took another 2 or 3 days of IVIG. And so, yeah, the struggle is real. It's going to continue, but there's hope. And that is my talk. Do we have any listeners who've submitted questions?
Before we go to the listeners, let's see if anybody in the room has any questions.
Are there any questions inside the room? Yes, please.
I would like to ask Amanda, of all that you went through, what was the scariest part, the tachycardia part, or what scared you the most with all that you went through.
I'm going to repeat the question. You had a thunderous voice, but the question was, of all that Amanda went through, what was the scariest moment, the scariest part?
The scariest part, different parts really. The scariest part initially, at first was, I think, when I first came across people not knowing who they were, but knowing that I should have known who they were. That was a pretty scary moment. 'Cause I remember telling my mom, I know I should know these people, but I don't know who they are. But she assured me that I would remember them. That was pretty scary. The tachycardia was pretty scary moment because I didn't know what was going on, and that was making phone calls. Somebody better come quick, because although family lives really close, my aunt lives right next door, and they can come in a moment, but you just don't know. That feeling is a horrible, horrible feeling. That the rush, it's not a good feeling. So you just get on the floor, and I knew that I needed to get on the floor. So that was a scary moment. Lots of scary moments, but family and friends have been very supportive. So that I've been very lucky with. So.
Good. Any other questions inside the room? Yes.
I actually had two. One as far as the gastroparesis and the potential misdiagnosis of an obstructed bowel. Is there some other test that can be done to rule that out before someone is taken to surgery by mistake, or do you just have to refuse surgery knowing you have West Nile virus?
I don't know what the surgical criteria are for opening up an abdomen to resect a bowel obstruction. Apparently, it doesn't require you to actually see the mass or the tumor, because when they actually opened up the abdomen, there was no mass or tumor. And the second question, I can't be, I sometimes can be a rebel, not to her degree, but I can't, advise patients who have West Nile neuroinvasive disease to essentially say no to a surgery that could be, where the condition could be life-threatening. That's why the surgeons are doing what they thought was the correct thing. But it's a very difficult call. If I had West Nile virus, I would tell them, no, go take a hike. Okay, but that's me. I'm pretty sure Amanda would do the same thing at this point. But really what we need is, since we contributed to the erroneous diagnosis by not making it clear that the virus can do this. Because this patient was already diagnosed with West Nile virus infection. And the story actually gets worse because when they took him out of surgery, they didn't know that his diaphragm was compromised. And so they took him off and he had a respiratory arrest twice. So they didn't factor that in either. Okay.
I really wasn't sorry.
Okay, go ahead.
As a family member, having a family member that had West Nile virus, is it fathomable to be tested yourself to see if you have immunity to West Nile virus, just to ease your anxiety about being fanatical about it?
So the question was, young lady who asked the question was, I had a family member who had West Nile virus infection. Can I or should I test my own blood to see if I have immunity, just to allay fears and concerns? The way you worded it is the proper way, and I would answer yes, you should. Okay, because a simple blood test is a very simple way to allay those type of anxieties and those type of fears. So yes, I would encourage that. Had you worded it differently, and this is for the same reason, if a patient is convinced that they have a brain tumor, at some point, I know it's costly, and I'm not going to ever get the award for most cost-efficient doctor, but at some point, I will order an MRI scan and say, look, beautiful brain. Feel better. Part of what doctors have to be doing is making patients feel better and not worrying about the cost. Any other questions? How about from the outside?
We have a few chat questions. I'll scoot closer.
Okay. Can you go ahead and read the questions into here?
Yes. Dr. Lace, in your last webinar, you discussed the Trojan horse pathway of neuroinvasion in which the virus hides inside polymononuclear neutrophils that cross the blood-brain barrier. This is mindful of the dormant sequestering of HIV in neutrophils as an evasion strategy from the immune system. Given that some journal articles question whether West Nile may be a persistent virus, perhaps sequestered in the kidney or some other organ, might not the HIV scenario also be considered as a possibility of persistent infection? Persistent infection has been shown in primates for years.
That is a beautiful question. So this is exactly where we have actually been, what we've been considering now for some time. And so several months ago, I spoke to my brother at the hematology oncologist, and I said, look, can we isolate Amanda's neutrophils, because only her neutrophils are affected. All the other cell types are perfectly normal, but the neutrophil count was 700. The absolute neutrophil count was 700. That's way low. And can we isolate them and find whether or not there are RNA particles hiding in her neutrophils? And he said, well, we can't do that here. But on those type of cases, I send the blood to, what's his name?
Neil Young.
Neil Young. Neil Young at I think it's either at NIH or Bethesda. And apparently that type of hematopoiesis center can actually isolate different cell types and search for things like RNA viruses. So beautiful question. And the same thing holds true for the kidney or the bladder. And I think that the groups in Houston are probably ahead of us and are going to be looking at that, or should probably already have been looking at it. And I believe they actually published a paper recently that actually showed some RNA fragments, but that was bladder. So a lot of those questions really have to be directed at the two groups in Houston.
Okay. My mom was diagnosed with West Nile virus neuroinvasive disease on September 6, 2017. She can talk and breathe on her own, but cannot walk or use her arms. She has a catheter. Is there any medication, supplement, or therapy that can assist her recovery? She is not on any special medication and is doing occupational therapy and physical therapy. Thank you.
Well, so it's a good question. There's no magic bullet. I can't say, take this particular medication or that one. What I can say is the following. Depending on her age, she should have a relatively good recovery if she's already up and walking around. The other issue, there is an age-related factor. That doesn't mean that I want to encourage her to walk around. If she's 80 and unstable, or dizzy, please don't have her walk around. She should be in a wheelchair, or at the very least a four-wheeled walker. There's no, again, magic bullet, but there are things you can do that are going to delay the recovery process. For example, if she's vitamin deficient, then recovery is going to be delayed. An example would be vitamin B12, which, if you're deficient in vitamin B12, and by the way, it is the most common vitamin deficiency in this country, because it has nothing to do with what you consume in terms of food. It has to do with whether or not your stomach lining can produce a particular factor. It's called intrinsic factor. And without intrinsic factor, you cannot absorb the vitamin B12. So things like vitamin levels should be checked, particularly B12, because when B12 goes low, you develop a spinal cord syndrome. It's called subacute combined systems. So both the sensory fibers and the motor fibers are going to be damaged. The other thing you have to be careful for is, when in a weakened state, you have to make sure that the limbs are not kept in a flexed posture, particularly an extreme flexed posture for too long a period of time. The nerves that traverse the joints, all these sites across the joints are called physiological compression sites. And so if you sleep and the arms are hyperflexed at the elbows, that patient can wake up with a complete ulnar nerve lesion at the elbow. And trust me when I tell you, that can develop even in 2 hours of improper positioning. I remember one case, this man was dragged by his wife to a picnic that he did not want to attend, and so he actually put his head on his hand and the elbow against the firm picnic bench, and 2 hours later he realized that he had complete numbness in his fourth and fifth digit and half the hand, and he lost function in 17 out of 21 hand muscles. And it happened because he compressed and actually severely damaged his ulnar nerve. Same thing can happen in the leg. And so hyperflexion at the hip can damage the femoral nerve. Hyperflexion at the knees can damage 2 major nerves, but mainly the one that cocks the foot up. So avoid these types of compression syndromes, and make sure that they take a multivitamin with meals and check a B12 level.
This one's a little longer, so feel free to stop me if I need to pause.
Okay.
Dr. Lace, this is more of a comment on your last webinar than a question, but I'm hoping you can expound upon it. I've been doing focused research on microglia and its role in the chronic pathology of West Nile. In the last webinar, you mentioned the Trojan horse pathway of neuroinvasion by West Nile and indicated that the protein osteopotin is involved in this action, and also gave some attention to the fact that osteopotin is involved in the pathology of cancer. This got me thinking about the many biochemical mediators secreted by activated microglia, and so I did a search, and it seems that osteopotin is indeed one of the chemokines derived from activated microglia and can serve as a blood biomarker for such activation. Wonders if strategies to reverse the phenotype of microglia could inhibit the release of osteopotin and subsequent neuroinvasion via the Trojan horse route, as well as suppress any cancer potential related to West Nile, provided there was a rapid acute diagnosis. The over-the-counter product sulforaphane, a concentrate derived from broccoli, has recently been touted as an adjunct to the treatment of prostate cancer. Is the mechanism possibly because it suppresses the OPN, and sulforaphane has been shown to reverse the M1 inflammatory phenotype of microglia to the M2 anti-inflammatory, indicating to me that if this is the route of prostate cancer inhibition, it may buttress the evidence that it does facilitate microglia reversal. Again, a search revealed the journal topic osteopotin, possible role in prostate cancer progression, Based on this cancer link, I submitted a poll in a West Nile survivor support group asking how many people have gone on to develop any form of cancer post-West Nile recovery, and of the 39 who responded, 7 members, or 18%, indicated that they had. I hope you find this useful, and I provided links for the journal articles below.
That's a wonderful comment, and a very important one. And so let me tell you, I think that you should contact our group here. This is exactly what we discussed in Houston less than 2 weeks ago. And we're all going to be looking at osteopontin. We have 2 absolutely seminal cases of cancer that developed in 2 West Nile patients. One was a tumor that really should have been so benign that even when we discover them, we don't dissect them, we don't take them out, and they're in the brain. But this particular cancer became extremely malignant, and the young man died of the cancer quickly. A cancer that should have been benign. And the other case was from Mayo Clinic, and it was a patient who developed a glioblastoma 2 years after West Nile neuroinvasive disease. Given that Dr. Bai and his group at Southern Miss have found that osteopontin can remain elevated in blood draws from prior years, I think it's a possibility that it may have played a role in these cancers. You really should contact us. Do we have contact information? Yeah.
You can always go to our website.
Go to the website, because we also have a survey monkey that we created, and so we don't necessarily have to duplicate things, but absolutely, I invite you to share your data, and we'll do the same. We need this type of collaboration. It's going to be very important. We'll also show you the survey monkey that we plan on sending out. We showed it to Dr. Murray and the Baylor group, and Dr. Hosbun and the UT group, and so we're going to be sending it out shortly. So please do contact us and come on board.
That's the last chat question we have. If anybody that's called in has a question, you can press #5 on your handset, and we can hear you in the room if you would like to voice your question. Dr. List, but nobody has a
Okay,
question.
good.
Good.
Until next time, thank you.
Thank you very much. This will be available early next week for your review and to share with friends and family. Thank you for joining us today.
Okay.